Hi there, I'm Lisa Hallsworth, professional engineer and CEO of Rillea Technologies, a company focused on chemical safety. Thank you for joining me for my ENG talk on preventing cancer. I co-founded Rillea Technologies in 2016 after working as a chemical engineer for almost 30 years. A big part of my job was chemical safety, and as someone who is always keeping a close eye on software and looking for new ways of doing things, I thought that maybe someday software might be able to make chemical safety easier. Today, Rillea Technologies offers a cloud-based SDS management and chemical safety platform called SDS Risk Assist. Our software reads WMIS safety data sheets, chemical handling regulations, and best practices, and highlights chemical hazards so that employers can make strong and confident decisions about chemical safety. We work with governments, labs, educational institutions, municipalities, manufacturers, medical and dental clinics, and even small businesses like automotive shops. This work gives us a unique view of workplace chemicals, the risks that they present, and the people who are affected. It also makes us very aware of emerging trends in the field of occupational disease. And today, I'd like to talk to you about how easy it is for engineers to help prevent workplace cancer. I would bet that we've all been touched by cancer in our lives. Young and old, the disease seems to know no boundaries. And we have seen the terrible toll that it takes on families. I would bet that we've even participated in campaigns like Relay for Life to fundraise for cancer research. But wouldn't it be awesome if we could prevent cancer? To know that you did your best to save just one family from the pain and suffering? Well, I'd like to show you how you can. Research on what causes cancer has evolved leaps and bounds, and we now know much more about what causes the disease. This image from the International Agency for Research on Cancer maps out exposures to potential carcinogens by types of cancer that they cause. And we even know that exposing our own bodies to certain carcinogens can not only affect ourselves, but our families too. What can we do about this? A recent report commissioned by the Ontario Ministry of Labour, Training and Skills Development and led by Dr. Paul Demers, Director of the Occupational Cancer Research Centre, revealed that in Ontario alone, over 3,000 cancers diagnosed each year are work-related. Dr. Demers' report reveals that a whopping 2.7 million workers are exposed to carcinogenic agents shown in this graph, just in Ontario, every year. This report also goes on to discuss how past statistics and present exposure data can be combined to predict the number of cancer diagnoses in Ontario annually. And this graph gives you an idea of the attributable exposures. Some of you may be surprised to see shift work listed as a carcinogen, but the science has related it to breast cancer. Other carcinogens like solar UV radiation and benzene are commonly recognized, as well as asbestos, though you, like me, may be surprised by the number of workers still exposed. This graph shows you the types of cancers that can be expected due to the exposures discussed in the previous slide. And the report even discusses the total lifetime costs of these cancers. Indirect costs such as healthcare, out-of-pocket expenses, insurance administration, informal caregiver costs, indirect costs like productivity and output costs, and replacement costs for workers, And finally, intangible costs, such as the monetary value of the loss of health-related quality of life. For example, the report estimates that the lifetime cost of lung cancer per case is $1 million, while the estimated lifetime cost for non-melanoma skin cancer per case varies between $6,000 and $11,000. So this year's lung and skin cancers alone will come at a lifetime cost of $1.4 billion and $13 million, respectively. Now you might ask, why haven't you heard about this before? Well, because this is new information and scientists and governments are working hard to make this information accessible. In the fall of 2020, the Occupational Cancer Research Center collaborated with the Ministry of Labor, Training and Skills Development, the WSIB, and the Canadian Centre for Occupational Health and Safety to launch a new website to help employers, workers, and medical practitioners to see statistics on occupational disease based on past data. Let's take a look at what some of the statistics are showing in industry sectors that have already been analyzed. This is a graph for the construction sector. The graph shows the increased rate of certain diseases as compared to workers in other sectors that are being tracked by the Occupational Disease Surveillance System. So in construction, we see that lung disease and bladder cancer is higher for workers than in other sectors. And we see the devastating latent effect of workers who have been exposed to asbestos. In healthcare, we see a large increase in breast cancers in both men and women. Could this be related to shift work? That's what the science is indicating. In metals manufacturing, the statistics show other cancers like liver, pancreatic, and stomach cancers. In mining, we again see the massive latent effect of asbestos exposure, but also the huge increase in silicosis and other lung diseases. And there are even statistics on the transportation industry. Here you see cancers such as melanoma, prostate, and non-Hodgkin's lymphoma. To date, these are the statistics that have been posted on the website. I've included the link for the website, and I encourage you to take a look. There's so much more information than I can summarize in this presentation. So why aren't we seeing these statistics play out in WSIB rates, you might ask? Here are the WSIB statistics for 20 years between 1997 and 2017. As we can see, traumatic injuries are falling, but occupational disease rates are increasing. Part of the reason why Dr. Demers and his organization were commissioned to do this report was to gain a better understanding about occupational disease in the province of Ontario. The ministry wanted independent science-based evidence to help develop their occupational disease policy, as well as to provide a reference for employers and workers that so they would have confidence that the compensation laws and the decisions were based on up-to-date science and best practices. So in fact, what the report found was that only about 6% of expected diagnosed cancer cases were receiving WSIB support. You see, most workers don't connect their illnesses to their workplace, and neither do their physicians. So imagine being diagnosed with a life-threatening disease and suddenly you can no longer work and having no financial support. So how can safety leaders and engineers help? If we look at the Occupational Health and Safety Act in Ontario, the law places a heavy burden on employers to protect employees from workplace hazards. And since employers or boards control budgets for the businesses, they hold the ultimate responsibility. However, professional engineers and safety professionals are hired as experts to advise employers and boards, and it is our duty to understand the law and protect the public to the best of our ability. In addition, part of our job is to stay abreast of the changing science and apply it in our work. So what actions can we take? If you've made it this far into the presentation, you've taken the first step. This is to become aware that the problem even exists. The next step is to learn about new science in the areas by visiting the sources that I've cited in this presentation and other reputable sources. Next, you can highlight the hazards within your workplace. Some hazards, such as sun exposure, are well publicized, but other hazards highlighted in Dr. Demers' report are invisible. People have to go looking for them, and the best tools are the ones that most engineers and safety professionals are familiar with: a hazards analysis and risk assessment. Once the hazards and the associated risks have been identified, the hierarchy of controls can be used to eliminate or control the hazards. For example, in the construction industry, machinery is now being designed to limit sun exposure. Make sure that this option is written into your specs. In the automotive service areas, ensure that ventilation systems are designed to manage occupational exposure limits for hazardous ingredients in the chemical products being used, and that vehicle exhaust is vented outdoors rather than within the working area. Purchase wetted stone cutters versus dry ones where possible to reduce the exposure to silica, respirable silica. And remember to think about hazards where you don't expect them. In this case, mouth mold grinding in dental labs. Collaborate with employees to ensure that their workplaces are designed to protect them in ways that make sense for their jobs. Read the WHMIS safety data sheets for the chemicals being used in your areas of influence and become aware of the hazards that cannot otherwise be detected by the body. And where possible, look for alternatives. In the picture, I have compared a number of different graffiti removers based on the hazards stated in their WHMIS safety data sheets. Assuming that they all perform the job equally, it's easy to see that the top product is the safest one for both employers and the employees. And where there are no other options, ensure that workers are equipped with the right protection to prevent harm. As professional engineers, we are obligated to bring hazards to the attention of employers and to lead the way to safer solutions. It is purposeful and interesting work, and I hope this ENGtalk has inspired you about how you can help prevent cancer in your workplace. If so, please share this video with your colleagues, and thank you for watching.